At the dawn of the 18th century, summoned by Peter the Great, Nicolaas Bidloo arrived in Russia. This distinguished Dutch anatomist brought not only his knowledge but an entire philosophy. In Moscow, on the Yauza River, Bidloo erected the country's first state hospital. Here, he established the first medical school, where he personally trained Russian students, imparting advanced European practices. He didn't just treat illnesses, he laid the foundation upon which all of Russian medicine now rests. The history of great discoveries rarely begins with sudden epiphanies. It emerges from painstaking, often unseen work. From the establishment of schools, the writing of textbooks, and the training of thousands. True progress is not a sudden burst of genius, but a methodical construction. This is precisely the construction Bidloo initiated, and it is with this construction that we will begin our immersion into history. Before these walls were erected, before the first textbooks and students appeared, medicine in Russia presented a different picture. It was a world where knowledge of the human body was sealed off, and diseases were perceived as divine punishment or the tricks of evil spirits. Wounds were cauterized with red-hot iron or doused with boiling oil. Pus accumulating in infections was considered not a sign of contamination, but a praiseworthy phenomenon, evidence that the illness was exiting the body. The absence of basic anatomical and physiological knowledge led to monstrous errors. Any fracture, any internal bleeding often meant a death sentence. The only method of salvation from gangrene was amputation, performed without any pain relief, often leading to shock and rapid death. Healing was left to folk healers, barbers, and monks, whose methods were based on superstitions, rituals, and fragmented folk traditions. Medical schools did not exist. There were virtually no qualified doctors in the modern sense. Every ailment was a trial, often fatal, met only with despair and primitive, often maiming intervention. This was an era when survival depended on luck, not science. Yet in the heart of Europe, in dynamic Amsterdam, a different understanding was already emerging. There, where anatomy and surgery flourished, a new type of physician was forming. One of them was Nicolaas Bidloo. He was born in 1660 in Leiden, at the very heart of Dutch science. His path was not that of a theoretical scholar. Bidloo was a practitioner. Years spent in the anatomical theaters of Leiden University, at the operating table, taught him the most important lesson. The body is a complex mechanism, not a refuge for evil spirits. He spent days and nights in Amsterdam hospitals. There, amidst groans and the smell of carbolic acid, he confronted the reality of disease, pain, despair, and the helplessness of even the most experienced doctors in the face of epidemics. He saw how wounds that could have been stitched festered, how simple fractures led to death, and how ignorance killed faster than the disease itself. This was not unique to Russia. It was a problem across all of Europe at the time. It was within the walls of university clinics, in debates with colleagues, and through studying the works of Vesalius and Harvey that Bidloo realized. It wasn't just about a lack of knowledge. It was about a lack of system, a system of education, a system of hygiene, a system that could preserve life, not merely confirm death. Every infection, every fever, every lost life was a challenge to him. It was proof that old methods didn't work, that new approaches were needed, structural changes. It was with this knowledge, this experience, and this burning desire to change the world that he arrived in Russia. Not as a mere healer, but as a builder, an architect of new medicine. His architectural plan began to take shape in stone and wood on the banks of the Yauza. In 1707, just a year after his arrival, the doors of the first state hospital swung open. It was not just a building. It was a living organism, the heart of future medicine. Here, within walls that still smelled of fresh lime, Bidloo began to bring his ideas to life. The first students, 25 individuals recruited from various social strata, commenced their studies. They learned Latin, anatomy, and pharmacology. But most importantly, they learned to see the human body not as a vessel of ailments, but as a complex system. Theory was important, but practice was everything. The first patients began to arrive at the hospital. Soldiers with wounds, peasants with fractures, townspeople with fevers. Each case became a lesson. Bidloo himself performed surgeries, demonstrating every movement to his students, explaining every decision. He taught them not to fear blood, not to turn away from pain. He taught them to face illness directly. Once, in the dead of winter, a soldier was brought to the hospital. His leg had been shattered by a cannonball. Amputation was the only salvation. But how to stop the bleeding afterward? The traditional method, passed down through centuries, was horrific. Cauterization with a red-hot iron, or, slightly less barbaric, pouring boiling oil. This procedure often killed the patient from shock or subsequent infection. But there was no choice. Bidloo prepared for the operation. The instruments were sterilized. The students froze, watching his every move. But then it was discovered. The supply of boiling oil was almost depleted. There wasn't enough to reliably cauterize all the vessels. Under normal circumstances, this would have meant a death sentence. The soldier would have bled out. But Bidloo was not a man of normal circumstances. He remembered his anatomy lessons. He remembered the works of his great predecessors. He knew blood flow could be stopped differently, not by destroying, but by occluding. He made a decision that seemed insane to many, but was the only correct one for him. Instead of hot oil, he took thin threads. Under the watchful eyes of the students, in complete silence, broken only by the soldiers' groans, Bidloo began the amputation. He acted quickly and decisively. As he severed the affected limb, he immediately, one by one, isolated and ligated each bleeding vessel. The thin threads tightened, blocking the flow of blood. There was much less blood than in a typical operation. There was no shock from cauterization at all. When the last vessel was ligated, the wound was clean. It did not smoke or sizzle as it would after boiling oil. It simply stopped bleeding. The result was immediately apparent. The soldier, though weakened, was alive. His pulse was steady. He survived. He survived not by a miracle, but by method. This was not just a successful operation. It was the triumph of European surgery over centuries of barbarity, brought to Russia. It was the first step toward making survival in Russia a matter of science, not luck. The soldier's successful salvation, achieved not by miracle but by precise calculation, was more than just a successful operation. It became a demonstrative lesson. Bidloo didn't just operate. He taught, using every case as educational material. His students stood by, absorbing every movement of the master's hands, every explanation. He taught them to see beyond pain and blood not chaos, but the inherent logic of the human body. The body, in his conviction, was a complex yet knowable mechanism, and his work consisted of deciphering this mechanism. This approach, empiricism, based on meticulous observation and undeniable experience, became the cornerstone of his school. In the hospital's anatomical theater, under the watchful eyes of his students, Bidloo regularly conducted dissections. He didn't just show internal organs. He demonstrated the connections between them, their functions, and most importantly, the damage caused by diseases or injuries. Every case, whether a successful treatment or, regrettably, a tragic outcome, became the subject of deep analysis and discussion. Students learned not to rote memorize outdated dogmas, but to understand the true cause of ailment. They grasped that every symptom, every scar, every change in the body was not a mystical manifestation, but the consequence of a specific disorder that could be studied and, perhaps, corrected. But how to make this knowledge not only accessible, but also systematic, transferable from generation to generation? Bidloo understood that oral transmission was limited and prone to distortion. Books were needed. And so he undertook the writing of textbooks. These were not dry translations of Latin treatises, understandable only to a few. They were adapted, practice-oriented manuals, written in simple, clear language. His intention was for them to become the foundation for thousands of future doctors in Russia. He demanded that his students not only master Latin, the universal language of European science, but also be able to apply their knowledge in their native Russian language. This allowed them not only to communicate effectively with patients, but also to independently teach others. These handwritten materials, created under his direct supervision, laid the first stones in the foundation of Russian medical terminology. He taught not only what to do, but also how to think. If a patient died, it was not a fatal acceptance of destiny. It was a challenge requiring an immediate response. Autopsy after a patient's death became mandatory and one of the most important lessons. Students were present, learning to correlate symptoms observed during life with pathological changes found after death. They learned to find the causes of errors, not to be afraid to admit them, but to use them to improve future practice. This was a ruthless but absolutely necessary school of self-analysis and continuous improvement. Bidloo introduced not only new treatment methods, but also fundamentally new tools of thinking and organization. He taught students to keep detailed, meticulous records of each patient, to record symptoms, describe the course of the disease, indicate the treatment applied, and most importantly, document the outcome. These case histories were not just bureaucratic formalities, but an invaluable source of empirical data. They allowed tracking the effectiveness of various approaches, identifying patterns, and learning from collective experience. This was the prototype of what we today call evidence-based medicine. The hospital on the Yauza, under his leadership, transformed into a living laboratory, where every patient, every case, every error, and every recovery became part of a common, constantly growing knowledge base. This meticulous, systematic approach, based on observation, analysis, and tireless learning, became the true foundation of Russian medicine. Bidloo didn't just heal bodies, he healed ignorance, replacing it with knowledge that was not sealed off, but open to all who were willing to learn, test, and act. Open knowledge, it seemed, should have been a blessing. But it became a challenge. Bidloo's arrival, his methods, his hospital, all of it shook the familiar world. A world where healing was the prerogative of the chosen few, and success depended on intrigue, not on healing. Court physicians, many of whom were foreigners themselves but long Russified and accustomed to their positions, saw the Dutchman as a direct threat. Their authority was built on secrecy, on the inaccessibility of knowledge. Bidloo, however, opened it to everyone. Accusations began. Whispers quickly spread through the capital. He's a sorcerer. His methods are ungodly. He cuts living people and teaches others to do so. Public dissections caused particular outrage. For many, it was sacrilege. How could one desecrate a body created in God's image? The use of thin threads instead of cauterization was declared a dangerous novelty, leading to inevitable death from rotten blood. Rumors spread that the Yauza hospital was a hotbed of disease, and Bidloo's students were dilettantes with no right to touch the sick. They were called underlearners, upstarts, disgracing the good name of physicians. These accusations were not just whispers. They were backed by official complaints to the Prikaznaya Izba, Chancery Office, and the Senate. Physicians whose patients, after unsuccessful treatment, switched to Bidloo and recovered, saw him as a personal enemy. They feared losing not only their reputation, but also their income, which depended on their monopoly on healing. For them, Bidloo was not just a competitor. He was a destroyer of their established order. He forced them to learn new things. He demanded evidence instead of centuries. Old dogmas. This was a direct challenge to their way of life, their understanding of the world. But Bidloo had a powerful shield. His patron was Peter the Great himself. The Tsar, who was constantly seeking novelty, who was ready to break the old for the sake of the future. Peter saw more than just successful operations. He saw how attitudes towards life, towards people, were changing. He saw a new force emerging for his empire. Healthy soldiers, strong artisans, capable of building and fighting. For the sovereign, medicine was not just charity, but a strategic resource, a guarantee of state power. Every complaint, every denunciation reached Peter, and each time the Tsar sided with Bidloo. He didn't just dismiss the accusations, he demanded evidence from his opponents, confirmed by facts. Moreover, the sovereign himself repeatedly visited the hospital, observing operations, examining recovering patients. He saw with his own eyes the effectiveness of the Dutch methods. He sent his officials to the Yauza hospital so they could witness Bidloo's work firsthand, and the officials saw not sorcery, but order, not death, but healing. They saw wounded soldiers who returned to duty, peasants who could work again. They saw living proof of Bidloo's righteousness. The monarch's will was unyielding. He did not allow the old world to stifle the sprouts of the new. The court physicians were forced to retreat. Their whispers died down. Their complaints went unanswered. Peter gave Bidloo not only a carte blanche, he gave him protection. Protection without which no great undertaking can stand against inertia and envy. It was this royal support that allowed Bidloo to continue his work, building the foundation of Russian medicine, step by step breaking down the walls of ignorance erected over centuries and paving the way for science and progress. The sovereign's patience ran out. Peter the Great could not be a shield forever. A final verdict was needed. In 1711, the Tsar ordered an unprecedented trial. It was a public examination, a kind of review that was to settle all disputes. The Yauza hospital itself became the venue for this decisive event. All those involved in the dispute gathered. Court physicians, their faces grim. Skeptical officials from the Prikaznaya Izba. The sovereign himself, his gaze sharp and demanding. And of course, Nicolaas Bidloo, surrounded by his 25 students. They were his living proof. First, Peter demanded the patient case histories. Not abstract treatises, but living testimonies of recovery. The students, under Bidloo's guidance, presented dozens of meticulously filled forms. Every symptom, every prescription, every change in the patient's condition. And most importantly, the result, recovery. These were not mere words. These were facts, confirmed by signatures and dates, undeniable to anyone who knew how to see. Then came the practical part. One of the students, Ivan, was tasked with diagnosing a soldier who had recently arrived with a severe leg wound. The old physicians were accustomed to general phrases, to vague predictions. Ivan, however, acted differently. He carefully examined the wound. He felt the pulse. He assessed the skin color. He asked precise questions about the pain, about the course of the illness. Then, to the astonishment of many, he clearly stated the diagnosis: deep infection, requiring immediate incision and drainage. And he explained why. Not by intuition, but by knowledge of anatomy and the signs of inflammation. Another student, Alexei, was to demonstrate the technique of ligating vessels. He was provided with an amputated limb. Under the watchful eyes of Peter and the old physicians, Alexei confidently isolated the arteries and veins. Then, using thin threads, he ligated them one by one. No bleeding, no cauterization. His movements were precise, confident. This was the very technique Bidloo had used to save the soldier, a technique that only yesterday had been called sorcery. The culmination was the dissection. On the table lay the body of a person who had died of an unknown disease. The court physicians, accustomed only to superficial examination, were bewildered. They muttered about bad humors and God's wrath. But Bidloo did not allow them to even approach. His students, under his guidance, began their work. They methodically, layer by layer, dissected the body. They pointed out the affected organs. They explained how the disease had spread. And finally, they accurately named the cause of death. This was not a guess. It was knowledge based on what they observed. The silence in the room was deafening. Peter the Great slowly walked around the table. He looked at the faces of the students, young, focused, confident. He looked at the pale court physicians, whose arguments crumbled before his eyes. The Tsar said not a word. He merely nodded to Bidloo. This nod was louder than any words. The next day, a royal decree was issued. It not only affirmed Bidloo's correctness, but elevated him to the rank of chief physician of the empire. His hospital was officially recognized as the central educational institution for training all future physicians in Russia. Students who successfully passed the examination were granted the status of physicians, giving them the right to practice medicine everywhere. And Bidloo's methods, anatomy, surgical ligation, keeping case histories, became mandatory for study. This was not just the end of a dispute, it was a turning point. A boundary separating centuries of superstition from nascent science. Bidloo, recently an outcast accused of sorcery, was now an undisputed authority. His name, his methods, his school, all of it was now not just permitted, it became law. A law that paved the way for the birth of a new, scientific medicine in Russia. The royal decree took effect, signifying not merely the triumph of one man, but fundamental changes in the very fabric of Russian medicine. The hospital on the Yauza, initially an island of innovation, now became a model, a center of attraction for all who sought true medical training. Treatment protocols changed radically. Barbaric cauterization with red-hot iron or boiling oil became a thing of the past. The method of vessel ligation, demonstrated by Bidloo and his students, became mandatory. This immediately reduced the percentage of deaths from blood loss and shock during amputations. Wounds began to be washed, not sealed with pus. The cleanliness that Bidloo tirelessly demanded became the norm in operating rooms and wards. This not only reduced the number of infections, it changed the attitude towards disease itself, showing that cleanliness was not a whim, but a tool for salvation. Diagnosis also changed. Instead of divining bad humors, students learned thorough examination, palpation, and symptom analysis. Every patient now became an object of meticulous study. The case histories introduced by Bidloo transformed from his personal preference into a mandatory document. They recorded everything, from body temperature to the smallest changes in a wound. These records allowed not only tracking the dynamics of a specific case, but also accumulating invaluable statistical material. For the first time in Russia, it was possible to speak not of isolated cures, but of trends in recovery, of the comparative effectiveness of different approaches. The most noticeable changes concern survival statistics. Few precise figures from those years have survived, but indirect evidence speaks for itself. At the Yauza hospital, which received the most severe cases, including soldiers with combat wounds, mortality from amputations decreased several-fold compared to previously applied methods. Whereas any serious wound was almost a guaranteed fatality, now hundreds of people who would previously have been condemned returned to life. Soldiers who lost limbs but survived could receive prostheses and again be useful to the state. Peasants who suffered complex fractures returned to work. These living examples became the most convincing proof of the effectiveness of the new medicine. Institutional changes followed Peter the Great's decree. The Yauza hospital ceased to be merely a hospital. It became a full-fledged academy. The number of students, initially 25, began to grow. Young people capable of sciences were sent here from various corners of the empire. The curriculum expanded. In addition to anatomy and surgery, courses in pharmacology, botany, and physiology were introduced. Bidloo didn't just teach. He created an entire generation of doctors who thought in a new way, relying on knowledge rather than superstition. For the first time in Russia, a centralized system for training medical personnel appeared, based on European standards. Graduates of the Yauza hospital, having received the title of physicians, went on to serve in the army, navy, and new cities, opening their practices and disseminating the knowledge they had gained. Each of them became a bearer of the new paradigm, destroying the remnants of the old, ignorant world. Medicine ceased to be the domain of accidental healers and became a professional activity requiring deep knowledge and strict discipline. This measurable effect, saving lives, returning people to full activity, the emergence of an entire class of qualified specialists, became undeniable proof that Peter's investments in science were not just a nod to fashion, but a strategically sound decision. Nicolaas Bidloo didn't just open a hospital, he opened a path to a future where the health of the nation was not a matter of luck, but the result of a systematic scientific approach. Nicolaas Bidloo, a foreigner who brought European knowledge to Russia. His paradox: he confronted centuries of inertia, but did not break. His weapon was not a scalpel, but a system. Not quackery, but science. Rejected by many, he forever changed the very concept of healing on Russian soil. He didn't just heal bodies, he healed minds. He showed that the path to progress lies through openness, through a willingness to learn, through the ruthless destruction of dogmas. Bidloo's story is not just about medicine. It is about how one person, one will, one idea can pave the way to a future where survival depends not on luck, but on knowledge.